Hello guys, you know that I'm trying to change your inside thinking in here about time. Today we're gonna meet a guy, he can even change your outside.
Hello, my name is Jens Urs Berli and I'm a plastic and reconstructive surgeon practicing here at Oregon Health and Science University. So I'm a gender surgeon by trade, meaning that I do surgeries to assist patients that are suffering from gender dysphoria to align their physical appearance with their internal gender identity. And that can be going from male to female or female to male, or also some patients that identify as non-binary, which means they don't identify on either end of the spectrum.
So what is one of the most challenging things in surgery?
So for me, the most challenging surgery, which I now is my favorite surgery, is microsurgery. You know, where you connect small blood vessels and nerves, which I do for the phalloplasty, so for the creation of the penis. And during that surgery, you know, every little step matters, because if the vein or the artery, so the inflow or the outflow of the flap doesn't work, then the whole surgery was for nothing. Whereas other surgeries, you can do an okay job, you know, and you can still have a good result. But here, if it clogs and something happens, then everything was for nothing. The other thing that I had a shortcoming in personally, you know, when I was in sports, I would always be okay losing. You'd be like, well, whatever, you know, the team loses. You know, I didn't have that, like, I have to win, that kind of mentality. Whereas in microsurgery, even sometimes things don't go quite as well as you think, and you just can't give up. Like, you have to, you know, you have to overcome that. And kind of fitting with the time concept that just comes to mind now is, there was always this ad in the Zurich airport. It's kind of a dumb slogan, but it says "Don't crack under pressure," yeah. And it was like an ad for a watch. That slogan really took to me because I usually always kind of did crack under pressure playing squash or whatever it was, and in microsurgery you just can't, you know. So there's these moments under the microscope where you're just like, your thought comes in, I can't, it's not gonna work, it's not gonna work, it's not gonna work. You know, but then you like realize that, you know, failure is just not an option because it is the patient, you know, for so many reasons, right? So kind of overcoming that little internal kind of, yes, it will work, and just believing it will work.
So last night you were also at the speech, Let's Talk About Time.
Yeah, it was great.
Yes, that was
Thank
good.
you, by the way.
Yeah, thank you for coming. We talked about moments, creating moments, and I said you are creating big moments for your patients, but do you remember a moment in your life, in your career, which was emotionally intense?
Yeah, there's obviously in the life of, you know, as a physician, there's so many intense, both positive and negative, you know, and emotions that you go through, and you can almost divide them into some emotions that are just, you know, based on your successes, that classic, like pass an exam or your first surgery alone, or you're learning all these kind of, you know, personal kind of stories. But then there's of course the patient interactions, you know, the first time you tell someone, you know, bad news, or, you know, the first time you celebrate something good together, you know, and then there's, you know, the moments in the OR, and I'll, you know, talk about one afterwards that was kind of defining for me. But as you asked me the question, just kind of the first thing that popped in my mind, because, you know, it's in the recent past, coming out to Oregon, you know, performing these phalloplasty procedures. It's such a rare type of procedure, and there's really not many people around here that do those. So it was a daunting task to set all that up. And one of my first patients here that just trusted me, even before surgery, he said, well, my friends told me, you know, maybe I shouldn't come to you because you're just starting doing these procedures here, but, you know, for some reason I just trusted you, you know. So obviously that's a big pressure. So we went through all the surgeries and you know, the different stages, and then he came. It took up to a year, you know, it's multiple surgeries, so you get to know patients pretty well, so kind of become very personal. And then he came for his last appointment, you know, and now he's able to stand and pee. He says he feels comfortable going to a locker room and just showering. And I was like, all right, I think this is it. You know, he's had all his surgeries, he's had his hormones. I was like, you know, this is it. You know, and said his name. I was like, you know, there's nothing else I can do for you. You're male. You know, and he started crying. I started kind of crying, and I was like, you got to leave now. And he was like, all right, I'm going. And so. But of course, I mean, you know, you're always going to take care of the patients in the long run, which is so rewarding in this type of work. But
that's special. That's really special, I think.
Yeah.
So I am very happy that you met Jens. And you also have to know that Jens and I, we were childhood friends, and we always had one thing in common, and that was when we got together, we had those laughing attacks. And I'm very happy that this hasn't stopped. And I'm happy that you get to know someone like Jens, which is this surgeon, and on the other hand, he has this fantastic humor, and you can really have a good laugh with him. And I think that's what you need. Maybe we're gonna need one other video, we never know.
You can't put. Good night.
Oh, nice
Yeah.
answer. Okay. Jens and I, we just had one problem when we were kids.
3 decades ago.
When we started to laugh, we couldn't stop.
And it happened. And it hasn't stopped since. Cheers.